In Kuwait, obesity and type 2 diabetes are rising at alarming rates, especially among young people. Dr. Hend Alqaderi, a researcher in dental public health at the Ministry of Health, teamed up with researchers from Dasman Diabetes Institute, the Kuwait School Oral Health Program, and Kuwait University to set up the largest longitudinal study of its kind in the Middle East, the Kuwait Healthy Life Study. The study, funded by the Kuwait Foundation for the Advancement of Sciences and Dasman Diabetes Institute, involved collecting data from over 8,000 Kuwaiti children to study diabetes and obesity risk factors. They followed up with the same children 7 years later and found 20% of them were at risk of developing diabetes. Alqaderi and her colleagues successfully identified key salivary biomarkers in saliva and blood, bacterial patterns in saliva, and lifestyle habits linked to diabetes and obesity. Using saliva to predict disease is a simple, less aggressive, and non-painful method compared to blood. The team proved that saliva can effectively detect biomarkers such as elevated insulin and C-reactive protein, indicating a higher risk of developing diabetes and pre-diabetes. A key finding of this study was that children who go to bed late and those who don't get enough sleep at night are more likely to have disturbed secretion of inflammatory biomarkers such as interleukin-6, leptin, adiponectin, insulin, and C-reactive protein. These biomarkers eventually increase their risk of developing diabetes, heart disease, and some cancers. Based on their findings, the team has recommended lifestyle improvement and systemic changes for healthcare providers and public health policy stakeholders, such as introducing some sleep intervention programs and to conduct more research on salivary biomarkers, so it can be used as a simple detection tool and more young people can be included in diabetes and obesity prevention programs.